Gallstones. Gallstones are small stones which forms inside the gallbladder, which can move from the gallbladder and block the bile duct and pancreatic duct. This can lead to a number of symptoms and complications. Before we move on to gallstones, let's first understand the anatomy and physiology of gallbladder to get a better perspective of the condition. The gallbladder is a pear-shaped organ present just below the liver, whose main function is to store and secrete bile. Bile is a greenish-yellow substance or juice produced by the liver and sent to gallbladder for storage and saturation. It is made up of cholesterol, bile salts, bilirubin, phospholipids, water and electrolytes. The gallbladder saturates the bile by adding more cholesterol and absorbing water and electrolytes. This bile is required for digesting food, especially the fatty foods, cause it is bile which have the properties of emulsifying fat. Thus, whenever a person eats a high fat diet, gallbladder releases bile in response. Now if you look over here, you can see this right and left hepatic duct here, leaving the liver and forming the common hepatic duct together. This common hepatic duct combines with the cystic duct which arises from the gallbladder, and both together forms the common bile duct. This common bile duct passes through the pancreas and is then joined by the pancreatic duct as it opens into the duodenum via the ampulla of Vater. Thus, bile have to pass through this biliary system to reach the duodenum where it will help in digestion of food particles. So I guess you already understood what the problem can be here. Gallstones basically can end up blocking any part of the biliary system, which in turn will lead to a lot of other problems including inflammation of the ducts and pancreatitis. But wait, what caused these stones to form in the first place? To understand this, you will have to understand the composition of bile and the types of gallstones. So as I said previously, bile is mostly made up of bile salts, cholesterol, bilirubin, phospholipids, water and electrolytes. Look at this pie chart here. As you can see, almost 97 to 98% of bile constitutes of water. From that, the remaining 3 to 2% constitutes of solutes. Now the solute part is mostly made up of bile salts, that is 61%. Fatty acids constitute 12%, cholesterol 9%, proteins 7%, phospholipids 3%, bilirubin 3% and remaining other electrolytes and substances 5%. Now ignoring all other constituents, let's just focus on these three components: cholesterol, bile salts and phospholipids. Bile salts and phospholipids, along with being part of the composition of bile, are also the substances that help keep cholesterol in a liquid state. If cholesterol precipitates, it will become solid and hard and convert into a stone. So there are only two plausible ways this stone can form. First, if there is too much cholesterol which cannot be kept soluble or liquefied by the bile salts and the phospholipids, or second, if there is too less of bile salts and phospholipids which is not adequate to keep the cholesterol liquefied, allowing it to precipitate. Genetic mutation in cholesterol metabolism or gallbladder functions, improper emptying of gallbladder, too much excretion of cholesterol in bile by liver, long standing of bile in gallbladder causing cholelithiasis, all contributes to the formation of this type of stones. The bilirubin or pigment stones are also formed because of change in composition of bile. When too much bilirubin enters the bile, it combines with calcium salts to form the bilirubin stone. Bilirubin can increase in bile mostly because of the higher rate of destruction of RBCs which produces this pigment in the first place, or because of liver disorder which causes excess of bilirubin. Again, stagnation or stasis of bile can also cause bilirubin stones. So briefly speaking, anything that can cause a change in composition of bile or allows bile to stand for a long time can cause gallstones. A mixed type of gallstone forms because of the combination of all these factors. So this is how gallstones can form. A person who have gallstones can have varied symptoms, ranging from no symptoms at all to severe pain in back or upper right abdomen. The person will also have indigestion, nausea or vomiting, and cramping in abdomen. Jaundice may also be present, and fever and chills may accompany the other symptoms. Gallstones can be diagnosed by MRI scan, CT scan, and some even can be detected on X-rays. An abdominal ultrasound is considered the gold standard test for this condition. In some cases, endoscopic ultrasound may be used. Abdominal ultrasound is a non-invasive technique where a transducer sends signal to the computer to generate an image of the gallbladder and its structure. In endoscopic ultrasound, an endoscope, which is a thin flexible tube with a transducer at its tip, is inserted through the mouth into the GI tract to get the images. An endoscopic retrograde cholangopancreatography is both diagnostic as well as therapeutic procedure, which is done only under specific circumstances. Here, a flexible tube with a camera at the end is used to assess the biliary system, and if a gallstone is stuck in it, it can be removed during the procedure itself. Coming to the treatment of gallstones, it can be classified as medical treatment, surgical management, or procedural management. Medications such as ursodeoxycholic acid and chinodeoxycholic acids can be used to completely dissolve a gallstones by increasing the level of bile acid. As discussed earlier, we already know that bile acid helps liquefy cholesterol. Thus, increasing its concentration in gallbladder can help dissolve the gallstones easily. The use of these gallstone dissolving drugs are called as the oral dissolution therapy. Other than this, patients may be prescribed NSAIDs to reduce inflammation and treat biliary colic. Biliary colic is a term used for the pain attacks that occur due to gallstones. Surgical management, especially for multiple or bigger stones, are available only if it is difficult to manage pharmacologically. Cholecystectomy, whether open or laparoscopic, is used for the same. Cholecystectomy means removal of the gallbladder. The surgeon makes small incisions to remove and throw out the gallbladder. Now you may have this question in your mind, can we live without the gallbladder? The answer is yes. And it may come as a shock to you, but remember, gallbladder only stores and saturates the bile. Without gallbladder, the bile from the liver is directly emptied through the bile duct into the duodenum, and the function continues. Thus, except for minor discomfort, digestion may still be completed without problems. Coming to procedural management, ERCP is minimally invasive procedure through which a bile stone stuck in the bile duct can be removed directly. Extracorporeal shockwave lithotripsy is another procedure in which shock waves are sent through the body to break the stones. The patient lies down on the table where the machine sends the wave through the abdomen, through the gallbladder to break the stones. This procedure is non-invasive and effective in some patients. Gallstones are painful, and even though we can live without gallbladder, we cannot live without treating this condition. Gallstones can lead to inflammation of the bile ducts and can even lead to pancreatitis. Thus, proper care and treatment is required for the same. I hope this brief discussion about gallstone was helpful to you all. If you have any further questions, please do comment in the comment section. I hope you all are healthy and great. Please do like, share and subscribe the channel. See you soon.